Um, my name is Dr. Regina LaRocque. I am a board member of Sustainable Wellesley, and I'm a infectious disease physician and specialist at Mass General Hospital. And I apologize that I had to interrupt the last video. I'm not sure if it got posted. So I'm here just to answer a few questions as a service to people in Wellesley, and I am just representing myself and trying to provide information for the community, and I'm just going to be brief tonight. So I have a couple of questions here. Watching Governor Baker's daily press conferences, it's hard to figure out what the situation is in Massachusetts right now. Can you help us understand what is happening in our hospitals at the moment? Well, I think I should just say again that I'm only representing myself, and I don't, I can't share any experience beyond that. And I think it's really important to recognize that this is a really rapidly evolving situation, and that I think even for us in the healthcare field, it's very hard to have a complete handle on what's going on throughout our own city and state, and I think it's a changing situation day by day. And the bottom line is that we are in the surge phase of an epidemic, and there are rapidly increasing number of cases and people who are severely ill. In our own institution, it's fair to say that we did a lot of work to kind of clear the decks and prepare for influx of patients, and we are now seeing that, and it is increasing at a rapid pace every day, and I'm confident it's similar at other hospitals and other places around the Boston area as well. So I would say we are experiencing an epidemic, an alarmingly fast-moving epidemic with lots of very sick people. It may not feel that way if you're not in the hospital per se, but if you are in the hospital per se, it is a alarming and rapidly evolving situation with a lot of sick people. Do Massachusetts healthcare workers currently have enough personal protective equipment? I think this is something that has been a big concern, and it has been getting some coverage in the press, and I think the coverage in the press has begun to wrap its hands around the complexity of the problem. The bottom line is that we are having to ration personal protective equipment at this point because we are limited. There's been a lot of goodwill in the community to donate supplies, even to make supplies, and to acquire supplies. But the problem we have right now is that the supply chain is not working. We don't have a reliable source of materials, both personal protective equipment and other supplies that are essential. And I think that the reasons for this are complex, and they have to do with the way hospitals typically operate, which is we don't have a stockpile of many things. But I think there has also been a lack of a supply chain from the federal level to the states that has been reliable. And I believe our own Governor Baker wrote about this in an op-ed in the New York Times recently. So this is a hard problem, and it's a difficult situation to be in an early phase of a surge that you are already having to ration supplies. So I'm not sure what the way forward is going to be. It seems to me that we need to produce our own materials in order to solve this. And so we need our leaders to, and I think they have heard the message, but I don't know what the solution is going to be. I think for those of us in the healthcare profession, the notion of having to reuse or make handmade protective equipment is not particularly comforting. So, and again, it's not just personal protective equipment. It's a lot of kind of basic other materials that are essential to the work, like swabs that you use to collect specimens for testing, the media that you use to transport specimens for testing. I think another real weakness in our supply chain is the fact that a lot of the medications that we commonly use are also made overseas. And so when the supply chain goes down, we don't have access to the things that we need in order to take care of people who are very sick. How are healthcare workers coping with the stress of this situation, and what can we do to support them? I think there's been a real outpouring of concern, and that is much appreciated. I think the biggest thing people can do is to adhere to the stay-at-home advisory and to encourage their communities to do it. And I think that, that is the most important thing right now. And some states have orders. We have an advisory. I think it's been a little hard for people to understand what activities are essential and which are not, and a lot of that has been a source of confusion. To my mind, everybody who is not doing something that is key to the functioning of our society really needs to be staying at home, and that's the single most important thing people can be doing to help healthcare workers, to be honest with you. Governor Baker just said the peak in Massachusetts will be the week of April 7th. What can we expect to happen, and is there anything we can do to prepare? Yeah, that's our impression too, is that somewhere around April 8th to 11th, we will have a peak in this surge. These are just projections. What will it look like? It's a little hard to know, because every day it's been dramatically worse. And, I think there's a lot of effort to open space and capacity, but I think that we're already stretched here, and I don't know where additional people are going to come from to care for individuals, and space and supplies. So I think it's going to be a pretty difficult situation in the coming days, and we're all prepared for that mentally as best we can. So again, the main thing that we can all be doing to prepare is to try to prevent as many transmission events as we can. Not make people not get sick, avoid having to seek health care. And I've said before that I think it's really important for people to have some serious conversations about what their end-of-life wishes look like, and to make that clear, because I think there was a piece in the Boston Globe by a number of ethicists, and people are lining up to think about how we're going to make some really hard decisions. And so I think it's best if we don't have to make hard decisions for people who already know what their end-of-life wishes look like. How will we ever get out of this? Yeah, that's a really important question, and I think it has yet to kind of, I think, emerge on the horizon of what that will look like. I've spent some time sharing thoughts with people. I mean, I think there's many who, there's many who have ideas about this, and I guess my one point on that front is that I encourage everybody to take a look at what Dr. Tom Frieden, the former head of the CDC, has been saying, because it is concerning that the federal agency that is equipped and has the manpower and the expertise to get us out of a situation like this, which is the Centers for Disease Control, they don't seem to have a seat at the table in the way that I would have expected them to at this point, because in order to get out of this, we're going to really need a lot of expertise. We're going to need an army of public health workers. We're going to need mobilization of supplies and a warlike effort. And actually, Dr. Frieden, I thought, appropriately called this World War C. And I think that is the mentality that we are going to have. And so to mobilize that kind of effort is going to require tremendous vision and leadership, and really can't be done simply on a local basis either, because all of the events that occur in any one community influence what happens in other places, because we are still moving around, and frankly, the activity we see now is really a reflection of virus that was circulating some days or a week at least ago. So we have yet to see the consequences of what's happening today. So it's a difficult situation, but we are going to need to come together and address this, and we are going to need a laser-like focus on doing control. And again, we don't have any treatment tools, we don't have a vaccine, and although many people are working feverishly on this now, it's not going to be available anytime soon. So So I think I'm going to stop because I'm tired. And I just want to underscore that I know it's hard to cut through the fog of kind of understanding what is happening, but there is a very dramatic number of sick people coming to hospitals in Massachusetts, and it's been getting worse by the day. So somebody just popped up with a question, and I'll answer it. Out of reported tests that have been administered, what percentage can we assume are still pending? So this issue of having access to diagnostic testing is really very much, a dynamic situation and a piece of the puzzle here, because there definitely have been a lot of efforts to ramp up the ability to test people here in Massachusetts, but we're still behind the 8 ball on that, and the other issue is how quickly you can turn tests around, and who you can test, and how you can use the results of the test to direct people's care. And so I think, even now we still are having to focus the testing on people who need it the most, which is people who are in the hospital or healthcare workers, because those are the people you really need to know if the infection is present or not. And so, we are not rolling out diagnostic testing broadly in the community in Massachusetts. And so if somebody has a positive test, it generally means it's come from a person who really needed to have that test done, and that means that they're sick. Having access to a rapid point of care diagnostic test is going to be an essential piece of controlling this in the coming weeks. And you need to be able to quickly test people, direct them to care or quarantine, and we don't really have that yet. in Massachusetts. So that is it's just a tool in the toolkit, but it's an important tool, and we don't have it really. Again, every day things are changing, but we don't have that at this point. So I think I'll sign off, and I'll see if I can do this again in coming days. I think we're all just stretched really thin, and it is hard to kind of pierce the fog with information, and even for us to keep up with what's going on is a strain. So I'll just emphasize again, everything I've said tonight is just my own personal perspective, and I do think it's really important to seek out reliable sources of information. And of course, the CDC has very good information about what to do if you're sick, and how to take care of your home. The Massachusetts Department of Public Health has information about cases in Massachusetts. The town of Wellesley website and communications are important sources of information. I do continue to think that the New York Times coverage has been really spot on, and the Boston Globe has more recently, in the last days to weeks, really been covering the situation in Massachusetts very accurately. And I think one addition is the New York Times now is tracking kind of the epidemic curve in different parts of the country, and that's a really interesting piece of information to look at. So again, I'll just say that it's important to make sure you're getting your information from reliable sources. And again, thanks everybody who is adhering to the stay-at-home orders and advisory, and really insisting that your own communities do everything they can on this front, because it's the most important thing to be doing right now. And I think taking care of your neighbors and checking in on people who are isolated, and trying to remain emotionally connected through a time when we are supposed to be physically separated, those are all really important things also. And it's one of the challenges of responding to this as well. So thank you, and good night.